Hi, my name is Eva Steiner, and this is my project Psychotherapists Around the Globe. I am interviewing the psychotherapists around the world and asking them the same 8 questions. I am wondering how mental health profession is in their country. Today we are going to. Thank you for taking this time for doing this interview with me. Before we start, can you tell me a little bit about yourself?
Thank you for receiving me. So I am Mutaina Amrebut. I am a psychologist from Morocco. I specialize in clinical psychology and psychopathology, and I'm currently working with victims of gender-based violence. So I collaborate with NGOs working in this specific area.
Okay, so tell me a little bit about your culture. What is some holiday or tradition that your country celebrates? And if your culture would be an emotion, what emotion would it be?
What describes best my culture is diversity and a rich mystical universe. In Morocco, and depending on where you are, you're gonna see a large range and variety of cultural manifestations. The holiday that we celebrate in Morocco are for most of them religious, Islam being the religion of the majority of Moroccans. So I can say that the Feast of Sacrifice, where we commemorate the sacrifice of Abraham, is the most celebrated holiday across Morocco. We also celebrate the end of Ramadan, and we call it Eid. It's an Arabic word that means specifically feast. In rural areas, we celebrate the new Amazigh year, and Amazigh are the original people of north of Africa. Actually, they are not specific of Morocco. They are Morocco, Algeria, and other countries. It's an ancient calendar, the Amazigh New Year. So by now, I think we're going to be in the year 2974 or something like that. So we have other traditional and cultural celebration. We celebrate marriage, and we have specific ritual for that. We celebrate the birth of a child, circumcision as being a part of the religion, the Islam. And all of those celebrations are done in respect of certain rituals. The food is a central part of those celebrations. And most of our dishes are presented and eaten in one central plate. And if my culture was an emotion, I would say it's warmth. Actually, this is the impression that we Moroccan have of Morocco, and strangers, when they come, this is what they tell us about Morocco. It's warm. It's a happy place to be. Also, between regions in Morocco. So the culture in the north is very different from the culture of the south. Cities on the coastal area are very different from the other places of Morocco. So we have this disparity, and it's related to where you are and what you're seeing of Morocco.
Can you tell me a little bit more about these differences from north to south to coastal cities?
So the differences, you can see that in how people are, what they are wearing, what they are eating, what's their food. And food is, again, a very central piece of the Moroccan culture. And you can see that also in the language. In Morocco, we speak Arabic, a dialect specific of Morocco, very similar to the one spoken in Algeria, for example, but a bit harder to understand because it's a mix of French, Spanish, and Arabic in one language. And also we have this other language, is the Berber language, the language of Amazigh. We have different dialects actually in Amazigh. So the Amazigh of the north doesn't speak the same language as those from the south and those from the east, for example. Very different. And you can see how people are conditioned by the nature of the place they are living in. For example, in the coastal area, you can see that the economy and the people evolve around fishery. In other regions, maybe less, you can find, for example, that the economy and the culture evolve around jewelry. It's an agricultural country, so the people are conditioned by what they do and the activity of the region. And this shows in their different cultures. So two people who speak Amazigh might not be able to understand each other because they are from different parts of Morocco. It's not the same language, even though it sounds like the same language. The region of the south of Morocco is radically different of the other region. It shows in their perception of a lot of things. So how they perceive women, what is their lifestyle, what they do for a living. it's a very rich and different place. So even Moroccans doesn't understand that much this part of Morocco. I think this is fascinating. It shows the diversity of this place.
How did you become a psychotherapist in your country, and what is your therapeutic approach?
I'm a psychologist. So to be a psychologist in Morocco, you need to have a bachelor degree in psychology, followed by a master degree in psychology. In Morocco, we have different masters of psychology. To be a clinical psychologist, you need to be specialized in clinical psychology and psychopathology. Having an internship is a plus. It will help you a lot during your job while working with patients. Tutoring also is a plus, being tutored by another psychologist or a psychiatrist. We have this in Morocco too. So it gives you a way of understanding the practice and going from a more of the literature of psychology to a more of a realistic approach, an approach of how you work actually.
Okay, so it's not a must to go and have like a practice to finish the master. It's just a plus.
Yeah,
for clinical psychologists.
Yes, it's a plus because not all masters require that. In the master I've done, it was required. We had 2 years of intern at the hospital in Morocco, and we had to complete that. We had to see everything that was going in that hospital, but it is not mandatory. You need to have at least between 300 and 700 hours of internship. But if you have more, it's better, it's good. It will give you a diversity of frames of work. So working with NGOs is not the same as working in a hospital. It's not the same as working in your own private practice. So this gives you a bit of perspective, if you will.
And is there any law for psychology?
There are laws, but not specifically for psychology. We have laws for paramedical practices in general. Now psychologists are trying to have a law, so I don't know where they are for now in this project. But until today, there is no specific law for psychology. We have just our practice and ethics we learn while practicing and while being tutored by other psychologists and psychiatrists.
What about psychotherapy? Do you have any psychotherapy schools, or do you learn about cognitive behavior therapy, psychodynamics, or different therapeutic approaches in the psychology school master degree?
To be specialized in a therapy, you need to do additional classes. The classes exist to teach CBT, for example, or systemic therapy, for example, or emotional centered therapy, and you pay for that so you can learn this specific practice. So you can have the title of being a CBT, for example, practitioner, or more of a systemic practitioner. But during the masters, we have classes too for that, but they just don't dive into the subject that deeply. So if you want to specialize in one type of therapy, you're gonna need to do extra classes for that. And you learn from other therapists, sometimes from foreigner therapists.
And classes, these extra classes are organized through the university or are like separate from the university?
They are separate from the university. They are private classes. You go to other therapists that they organize those classes. Sometimes they are our university teachers. Sometimes there are psychiatrists who are trying to bring up more of psychotherapy from other countries. So they try to make it more accessible to students. And sometimes there are just psychologists who are trying exactly the same as the psychiatrists to expand and make it more available for others to learn psychotherapy.
How society looks upon psychotherapy or any psychological help?
Again, it depends on where you are in Morocco. So there is this disparity between urban areas and rural areas. In the big cities, for example, it's seen as a way of solving issues that one might encounter, and there is a great awareness and acceptance of psychotherapy. In rural areas, it's seen as a non-efficient way of addressing problems and mental health problems. Those problems are stigmatized in this area and addressed through traditional and magical practices. Many people turn to religious leaders, traditional and spiritual healers for help with mental health issues. And from my point of view, it's okay, really, as long as it's not harmful to the patient. My patients usually see me simultaneously as they are seeing a traditional healer, and it doesn't bother me. So it doesn't bother me because I think culture is bigger than me and in my practice. If they have something to do with that healer, it's okay. I will do my job, he's going to do his. So this is how I practice in Morocco, because you cannot have a judgment on the cultural way of dealing with a certain problem. You can just try to understand what's happening, and that's it, as long as it is not harmful for the patient.
And these both approaches, traditional healing and psychology, psychotherapy, do they accept both? Because
No.
I sometimes see that it's just one or the other.
I personally accept that. If you ask probably another psychologist from Morocco, he will have another answer. He won't accept that. I accept that because I was interested in culture at some point, and I learned about it, and I found that it helps them, kinda. If it helps them understand in their culture what's happening, by the words of their culture, by the practice of their culture. And I see that I'm nobody to judge that, or to stigmatize that, or to think that is wrong or that is right. If they're happy doing it, it's okay. Other therapists might not be okay with that specifically, but I don't see why we wouldn't be okay, as long as it is not harmful to the patient. Because sometimes these practices might be harmful. For example, they take some plants that are poisonous. This is problematic from my point of view. But other than that, I think that it's okay. They go, they do their because spirituality helps a lot of patients. And I shouldn't ignore that point if I want to understand really what's going on with my patient. Some problems from my point of view are problems, but from their point of view and in their culture, it's not a problem. We need to understand what's going on a cultural level, on spiritual level, to understand what's happening with the patient. If we ignore it, it's not going to make it better. If we refuse it, we don't have the power to refuse it, really. We are individuals. So we only have the option to understand it and work with it. And it helps with the patient because it helps you also build trust with the patient when he see that you are not refusing what is he doing with his life. You're not refusing what's his approach to treat his sickness or his mental health issue. They are more inclined to tell you more things and a lot of things because they get that you understand. And this helps me with my patient. So I will not turn my patient against me, saying to them that, no, this is wrong. Because I don't know if it's wrong, actually. I am one psychologist against the culture. I cannot judge the culture, but I can understand. So this is my own personal approach. For other psychologists, it might be not necessary in acceptance of these practices, but they exist. They're gonna exist, whether you accept it or refuse it.
So basically accepting the person as a whole with the values, belief system, and try to understand from where they are coming from.
Yeah, and it depends a lot on which region of Morocco this person comes from. And you're going to see a different beliefs, different practices, different way of thinking. Some goes more of spiritual healers and try more related to the religion. Other goes to healers that are more into magical things. We have a rich mystical universe, and it's very diverse, and you're going to hear a lot of stories. But it's interesting because if patients see that it helps. It's his mental health. It's his way of doing things. So yeah, this is my approach.
And if I dial back a little bit, why there is such a difference between cities and villages? You said in cities widely accepted. So my assumption is there is not much stigma. And in the villages, you said there is stigma. So tell me more about the difference and about the stigma. What kind of stigma? What kind of beliefs about mental health?
In the cities, we have a lot of people that went to school, and because of that, they understand that mental health issues and mental illness is an illness. In the rural areas, they still believe, in most of Morocco, believe that it's magical. This is the stigma, you see. If you go to anyone in any Moroccan city and you ask them about depression, for example, they might not be able to tell you what are the symptoms, but they understand that it's a mental health issue, it's an illness, and it's treatable. We can go see a psychiatrist, we can go see a psychologist, we can go see a psychotherapist. In rural areas, if you go and ask about depression, they don't know what is depression. This word doesn't exist for them. Depression means that you're cursed, and it's not said like that. They're gonna say that they don't feel well, they are not feeling happy, for example. They don't want to see people, they don't want to do anything, and they don't name it as depression. They are not going to recognize it as depression, but they're going to recognize it as something magical happened, or somebody did something to make this person in this state, and we need to undo it or to solve it. How we undo it or solve it? We're going to go to a healer. So you see, the perception is different.
What is your society teaching about child-parent relationship, and whether this value of society also influence how you design your interventions as a therapist?
In Morocco, child-parent relationships are deeply influenced by cultural, religious, and traditional values, and it is sacred. So the most common parenting style is the authoritative parenting, combining high expectations with responsiveness and support. We have also parents, more of an authoritarian model, if you want. The intervention, I think, must take in consideration those elements. So you need to understand how we perceive our parents in our religion and in our culture, in our traditions, so you can address the problems and you can work on a better communication, because in general the problem between parents and children is in communication. So you need to make good and healthy communication based on the cultural beliefs, on the religion, and on the tradition. Otherwise, they are not going to listen to you. They are not going to take what you're telling them. They are not going to understand. So yeah, you need to be very respectful of the culture, and this is very specific of, I think, North of Africa and most of Muslim countries. The place of a mother is sacred. And I noticed this because I work sometimes with people suffering from an antisocial personality disease. And, the antisocial has very cold feelings. He doesn't have much empathy. So it doesn't feel much about what's happening around them. But they are very sensitive to their mothers in Morocco. You can do whatever you want to that person. It won't bother unless you come across his mother. And this is a difference that is made by culture and by religion. So he's gonna be very violent. He's gonna be very aggressive to everybody except his mom. And I think this is fascinating. It's not what an antisocial might be usually. We don't see that in other frames. We don't see that in other cultures. But in Muslim cultures, this is what's happening, because the mother has a sacred place. So whatever she's going to say, he's going to do.
But what do you do in case of maybe verbal abuse, emotional abuse?
So the first thing I do is listen to the victim and listen to the parent. I need to listen to them separately. The reason I do that is because I need to have the different points of views. Maybe she's not aware that she's abusive. Maybe she's abusive because she's in a specific environment, or this is how she handles things. And this is fixable if I notice that she's just not aware. In other cases where she's aware, but the mother just doesn't care for whatever reason. Maybe she's suffering from a mental illness. Maybe she's, I don't know, the reasons might be very different from a person to another. I need to address that to protect the child. So, because I know that in the case of, for example, severe mental illness, there is nothing I can do if I don't protect the child first. So we need to stop the abuse. And again, this is because I work in NGO frame of work. So this is how we deal with those cases. We try to protect the child first and then address the problems that the mother is facing. If she's just not aware, I try to establish a healthy communication. So I receive both of them, the mother with her child, and I make them communicate what doesn't work in the communication, what is off, why she doesn't understand the need of this kid, and why this kid is not responsive to the mom, for example, or probably. And I try to explain what's happening, because it helps a lot when they understand that, yes, if you verbally abuse him or if you keep yelling the whole day, he's more inclined not to listen to you. And it's because you don't talk first. You just shout the whole day, and it's not an effective way of communicating. So I need to really see what is the problem and is it fixable. If I can fix it, I will try to fix it while talking with the patient and her child. And if it's not fixable, so it is due to a severe mental health illness, or for whatever other reason, or maybe she's just not good at being a mom, and these are real cases. I've seen people that are not suffering from anything, but they didn't want to have a kid, and they are with the kid, so they think that this is the kid's responsibility. So yeah, in that case, I will try to protect the child first, and then I will do a therapy with the kid to make him feel better about himself and not feel guilty because of the mother's behavior. I will try to talk to the mom also and have a therapy with the mom too, to understand what's the problem and to change if it's possible. Sometimes she refuses, and it is how it is.
And if an adult client would come to you and say, I don't want to contact with my parents anymore, how would you approach as a therapist, and how would culture look upon such a request?
As a therapist, I will listen to the why. What happened and why do you feel that way? It's his choice, of course, to have a contact with his parents or not. And I cannot make him do so if he doesn't want to. But I need to understand why, and I will try then to solve the consequences with that person by talking, and probably by changing his perception of things, some things that happens with his parent that he didn't understand probably, or he misinterpreted, or maybe that hurted him. So I need to get to a point where he's gonna say to me, yeah, they did that and that and that, and this hurted me so bad that I don't want to know them anymore. And it's legit. If he's in pain, it's legit. But I just open the possibility that maybe one day you might be able to forgive them, and maybe in that day you might be able to talk to them again. From the perspective of culture, it's seen negatively, if we want to say. It's a bad thing, because it's not just cultural, it's religious. We have a religion, and it's the religion of the majority again. Islam is very strict when it's about parents. We owe them respect. We owe them a great deal of recognition for their effort. For that, the patient's going to be perceived negatively by the culture, and he's going to suffer from that. So, and we have specific terms that we use to describe this particular situation. And it hurts, but people, the culture and people doesn't necessarily understand the why, because they don't need to understand the why again. They need to levelize, because it's going to make life simpler, and go on. When I have these cases, I just see if there is a possibility that maybe there is an error of judgment. And if it is, it's great because we can work on that and it's going to be better. You cannot forget about what happened, but you can forgive. And I will work with them to reach that point. Because if they are coming to see me, they want a solution. So they are looking for a way to forgive. They're just not going to phrase it that way the first day. And we're going to get to that by talking with the patient.
What are the learned beliefs regarding client-therapist relationship, and can the relationship continue once the therapy process is over?
It's a relationship based on respect and empathy, while maintaining an objective judgment and certain distance with the patients that allows you to stay objective. And the priority is to treat and help the patient and protect the privacy and dignity of the patient. This is why we don't keep seeing our patients after the end of therapy. And if we meet them in the street, if they don't come to us and they don't talk to us, we don't go say hi, because probably they are seeing us without telling anybody else. And it's my duty to preserve that privacy of the patient. Sometimes they're going to come to say hey, and I will say hey, but without mentioning anything that will lead the person they are with to understand that I am their therapist. So if they want to tell their environment and people around them, it's okay. It's their own choice, but I will not say anything that will lead the people that are with the patient to understand that I am a therapist. And again, it's because I need to preserve the privacy of the patient.
In a case of therapeutic abuse, so that the therapy is the one that crosses the line, is there any organization where the patient can turn to or not?
They can turn to law. So the therapist is supposed to maintain the privacy and dignity of the patient. If the therapist is abusive, they're going to have to sue him. But we don't have specific laws regarding psychologists and psychotherapists in Morocco. And this is a problem because, yes, I've seen abuse, and yes, it is something that I hear about very often, but we still lack the laws. So if the patient, I think, sue the therapist or the psychologist, it's going to be more because of the non-protection of his privacy and dignity, or because of a very obvious malpractice. Sometimes they are not even therapists, and they say that they are therapists and they abuse the patient, and nobody's going to protect you because it's very clear you need to do research before you go see someone about your problem. You need to know if this person is a real psychologist, is a real therapist, if this person is qualified to treat you, and then you go. I don't think there are organizations that protect the patient other than police and law.
And is supervision a must for a therapist in your country?
In Morocco, as in many other countries, supervision for therapists is highly recommended and often considered as a crucial part of the professional practice, although it may not be a strict legal requirement in all settings. But I think that it's very important, and it's the only way to really learn how to work with patients and understand the ethical standards required in this relationship and understand the pathology, because it's very different. What you read is different from what you see. You're going to read about, I don't know, bipolar disease, but when you see it, it's different. You read it, it's just clean and pure. You have symptoms and they are organized very well. But when you see it in reality, you might have a lot of symptoms that are not from the bipolar disease. They are not in the symptoms that are described in the books for bipolar disease. And it's very interesting because it teaches you how to look, how to search, how to ask questions, how to avoid a certain type of questions, but ask them differently so you don't vex the patient, so you don't hurt the patient. It actually teaches you how to work, and it's very important from my point of view. And what is more important for me is to have at least a part of the supervision in a mental health hospital, because it's going to show you what's frequent in the general population. Mental health, it's a public, it's for everybody. You're going to see a large range of pathology and symptoms in this institution, and you're going to learn a lot. It's going to help you learn because it's going to help you raise questions to learn more.
So from what you are saying, I assume that help is available through public health system, also privately, or both ways?
Health is provided through public system and private organizations. You have the right to choose. You choose if you can afford to pay private facility, you go to the private facility. If you don't, there is always the public hospital. What's interesting in the public health system of Morocco is that it has the best practitioner of Morocco, because we have professors there. We have really a good quality of professionals, but it lacks on other levels. Maybe you're going to go to a public hospital and not find any place to be and to be hospitalized there because it's full. So you're going to need to go to a private practitioner then, or to a clinic. So we have both of them, and the patients have the right to choose between them and what they prefer.
What are the most common complaints that the client come to therapy for?
I work with a very specific population, so I deal a lot with depression and PTSD. But when I was working, for example, in the hospital, in my internship, I've seen a lot of psychosis. Why I've seen a lot of psychosis? It's because other than that, for Moroccan, it's not serious enough to go to a hospital. So they're going to come when a person is presenting severe and acute psychotic symptoms. Otherwise, it's just going to be treated as sadness, or maybe, as I said, magical interpretation of what's happening. So yeah, now I see a lot of depression and a lot of PTSD, anxiety. Yeah, those are my most common cases, depression being the first, and followed by PTSD, followed by anxiety.
So tell me a little bit about depression. From where do you feel this is stemming from?
It depends on the patient and their lives. It's different from patient to another. You can have a very large range of reasons and sources for this sadness. Maybe it's because they lost somebody they really love. It's because they lost a job. Maybe it's because they are getting divorced. Maybe it's because they always felt that way, but they kept hiding it for a while. In that case, it's actually chronicle. They felt that way, but at that, they come see me in the point where they can no longer hide it and they can no longer live with it. You need to listen to the patient very carefully and understand why is he feeling depressed. Why? The why is very important. Maybe it's because they had an accident and lost, I don't know, they lost vision. They cannot probably. I have these cases too, people who had a certain type of accident and they are not able to use a hand anymore or to see very clearly anymore. And this makes them really depressed because yeah, it's logical actually. So what I do with them is to make them accept their new state. What happened to them happened, but it's okay. You can still live with what you have now. It doesn't mean that it's the end of life. Your life hasn't stopped yet. And if you're gonna live at least 20 more years or 40 more years, you might as well try to feel happier than that, or to accept what happened so you can live in a better shape.
So the way I am hearing you, the patients really come the last minute when they cannot hold it anymore.
Yeah. For the majority of them, they won't come and see me if they don't need really to see somebody. In a lot of cases, I need to address them to a psychiatrist too, because it's severe. We need medication. When I'm dealing with those thoughts, for example, I need to address them to a psychiatrist, and I work with the psychiatrist. So they are on medication and in therapy at the same time because it's urgent. I need to preserve the life of the patient first. If I'm going to do that through medication, I'm going to do that through medication. So I'm going to send them to see a psychiatrist.
Can you tell me your opinion why they are coming in so late?
They don't think that it's severe enough. They think that they're going to overcome it and it doesn't happen, and something else happens that makes the situation more complicated. So it's layers and layers and layers, probably sometimes of trauma, probably sometimes of events that make them sad, until they reach a breaking point where they cannot live anymore, or they need to talk to somebody so they can keep living. Also, because even to see a doctor in Morocco, we go the last minute. If we don't feel that we might die, we probably won't go. So if I am having, for example, a fever, things like that, I might not see a doctor right away. I will see a doctor when it's severe enough and I starting to think that, yeah, this is maybe dangerous, I might die. Then I will go see a doctor. So yeah, this is how we deal with health in general.
Is it like because of like the money is you need to pay for the doctor visit, or is it in the cultural belief, or from where this is stemming from?
It depends on the person. Sometimes it's for the money, and sometimes it's because when you're gonna go to the public hospital, because we have this available, you can go to the public hospital. There are plenty of people ahead of you. So you're gonna wait and wait and wait, probably for weeks, probably for months in some specific area of specialization. So yeah, it's for the money and it's for the availability of the doctors and how many patients there are to be treated. And if it's not serious enough, we won't go because we won't wait like 3 weeks to treat a fever. The fever won't be there probably anymore. We're gonna go the last minute because until then it's not serious enough to be taken care of. You see, it's a perception actually. When you ask Moroccans, they're gonna be like, yeah, I am having a fever. It might be something. Tomorrow I won't have a fever, so it's gonna be okay. It's gonna be all right until it's not anymore, and then you go see a doctor.
If you would share one tool, belief, or approach that is a must-have for you as a therapist, what would that be?
I would say listening to the patient, understanding the culture, and looking not only for what is happening, but for why is it happening, and not judging the patient, not judging whatever he's doing to feel better, because they are just trying to feel better. So if he's seeing a magician or if he's seeing a healer, yeah, he's doing that because he doesn't feel well. And not judge what's happening in their life. You're gonna hear a lot of stories, different stories. And your job is not to judge the patients, it's just to listen to them and try to figure out a way to help them solve what's happening. It might be CBT, it might be systemic, it might be whatever you think and you see that it will work for this patient, you're gonna do. So listen very carefully, and if you don't understand the culture of a patient, read and learn. You can't understand all patients, you don't know all the people on earth. So sometimes you're gonna face a patient, you're gonna see a patient with something that you never heard of before. You need to ask other psychologists or psychotherapists or maybe doctors, or go read about it, research a little bit, read articles, see in books, because you need to keep learning. The patients teach you more than you'll ever imagine. You just need to listen to hear them out. I think this is the approach and belief that I have, is that you always see a patient and try to listen carefully and to learn what is there to be learned. And if you need to learn more, you go and do the work. You go look for a way to help that patient. If you can't, you can transfer the patient to another practitioner that you think is going to be able to help that patient. And to respect the secrecy of the patients. It's very important. I cannot emphasize that enough, but it's very, very important. They need their privacy to be respected. They are trusting you with secrets that they've never told anybody. They are trusting you with their lives. They are trusting you with details about them. So you keep that to yourself. You don't share that. You don't talk about it. You don't say things that you shouldn't be saying, because you're going to lose the trust. And it's very important in our relationship with the patients. Trust is very important. You build it, you preserve it, and you do what you're supposed to do, is to help that person as much as you can, while staying and keeping a certain distance with the patient so you don't get involved in their life. You do what you can do.